Everybody. My name is Jean Bastilla. I'm with AWC and Home Care. I'm back for another topic. As you all know, we'll continue this journey of educating people in our society, educating people in the community where we live. We believe we have an engagement to educate as many people as we can about health topics. Today we're going to talk about diabetes. This is going to be so interesting. We're going to talk about so many part of diabetes. You're going to gain so much knowledge about how to manage diabetes and advice that you can give people about diabetes. It will be unbelievable. Again, my name is Jean Bastilla. I'm with AWC and Home Care. AWC Home Care is a home care company in Atlanta, Georgia. The purpose of this home care company is to keep as many seniors in their homes safely. AWC Home Care provide sitters and CNAs. We do from 4 hours of light housekeeping to 24-hour heavy duty care. If you start watching this video, I want you to share it with other people because I do want other people to also get this information. Let's talk about diabetes. What is diabetes? Well, as many of you know, you may not know exactly what diabetes is, but you do know it is a very common condition in our community. It is, again, the topic is about, we try to talk about seniors, but diabetes is a very common condition in our society. Well, diabetes, as somebody call it high blood sugar, and in a medical term we say hyperglycemia. It is a condition in which you have an increase of blood glucose or blood sugar. So you have an increase of sugar in your blood. This is what diabetes is. Now, we do have different type of diabetes. So we have type 1 diabetes and type 2 diabetes are the most common diabetes. Type 1 diabetes is a diabetes that usually occurs in people under age of 20 years. It accounts for about 5% of diabetic issues that we have. The other type of very common type of diabetes, which is the type that most of our seniors have, is type 2 diabetes. So type 2 diabetes is a diabetes that occurs in adults and elderly, and it accounts for about 95% cases of diabetes that we have. Now, what are the difference between the two types? Type 1 diabetes, because the thing is we have to learn a little bit about how our body works. You know, how when we talk about how does our body use sugar? Well, when you eat carbohydrates, the carbohydrates are the group of food like rice, pastas. Carbohydrates, it turns into sugar. The sugar is used by our body as a source of energy. So you eat the food, it turns into sugar, and then our body uses it as energy. Now, when we have the sugar in our blood, we have to have a way to transport it to our cells so we can get the energy out of it. So this is where insulin comes from. Insulin is produced by our pancreas. Our pancreas produces the insulin, and that insulin enables the glucose that is produced by the food that we ate. It enables the glucose to go into our cells. So this is how we get our energy. Now, two reasons people have diabetes. One of them is because the pancreas is not producing insulin, which is very common in type 1 diabetes. Is your pancreas does not produce enough insulin or does not produce insulin at all. The type 2 diabetes, however, your body produces the your it's your receptor is resistant. So you have a you produce the insulin, but it doesn't go that the insulin is produced, but you have it is resistant. So you have a resistance that prevent the sugar from going through the cell. Now let's talk about some of the risk or some of the issues that can derive from diabetes. Well, number one, you can cause you the early signs usually are thirst and frequent urination. What happens is because you have that concentration of glucose in your blood, the glucose pulls water out of your tissues, therefore causing you to have the feeling that you need to drink fluid continuously because it dries you up. It pulls all the water you have from your tissues. So that causes you to be thirsty. And again, because you pull all that water you have to go to the bathroom. So that's what caused the frequent urination. Okay. So those are the early signs. Now the late sign, we look at like flu-like symptom, like fatigue, because your body is not able to use the glucose efficiently. So that causes you to be fatigued. So you're very fatigued. You feel tired all the time. So those are you feel lack of energy. All these are kind of later signs of diabetes because you're not using the sugar correctly. So the sugar doesn't go into your cell because you have problem. Either you don't produce the insulin that will help transport the sugar from your blood to the cells. So you're gonna feel flu-like symptoms, tired, feeling dizzy at times and things like that. The other thing you may have weight loss or weight gain. Okay, so weight loss, the reason why you have the weight loss is obviously because you eat when your body convert those carbohydrate into sugar, but you can't use the sugar. So therefore you are not able to you don't have the fuel, you don't have the energy. So then you lose weight. That's why you have, weight loss. You can also have numbness and tingling, because usually if you have diabetes, you have poor circulation. You have poor circulation especially in your extremities. So that causes you to have neuropathy. We call that neuropathy, where you have tingling, burning sensations in your arms, your legs, and all. The other thing you can also have is gum disease. So some of the seniors, you'll see them having a lot of redness and swelling to their gums, and which can put them at very high risk for dental infection. They have frequent dental infection. And talking about infection, one of the things that occurs in diabetes, when you have diabetes, it causes you, especially in the seniors, it causes them to have frequent urinary tract infection. That's one of the things that happens a lot, because usually bacteria like to stay where sugar is. So if you have high sugar, it puts you at very high risk, or higher risk if you want, for infection. Now, let's talk about how we can prevent diabetes and the people who are at highest risk. Well, the risk for diabetes, one of them is weight, lack of exercise, family history is one, age 45 and over, stress and depression. So somebody who is very stressed and very depressed, yes, very easily they can end up having diabetes. That's why in some of the videos we did talk about stress. So we want to encourage our seniors or elderly or whoever, we want to encourage you to take the time one day out of your busy schedule. We want you to go and enjoy something that you like to do to help distress yourself, because stress can actually cause you to have diabetes. So we want to make sure we do that. Now, we want to encourage our seniors to decrease the amount of sugar and fat in their food. What we want you to eat, we want you to eat more vegetables and fruit, whole grain, and things like that. If you go to the store, instead of buying the white bread, it would be better for you to buy the whole wheat. Whole wheat is better for you than the white bread. So The other thing you do is exercises. As little as you can, exercise, go for a walk in your neighborhood, stay active. That's kind of very helpful. If you stay active, actually, there are research that has shown that in seniors, the two main reason why they have diabetes, one of them is lack of exercise, and the second one is overeating. So they eat a lot of the time, they don't eat the right food. They eat a lot of fried food, or they eat less of the good foods such as vegetables and whole grain, but they're eating like white bread, they're eating a lot of animal products. So that actually put them at high risk, and that accounts for a very high percentage of the reason why you have a lot of type 2 diabetes in seniors. So overall, when you have diabetes, you just have to keep managing it, because diabetes is pretty much a chronic condition. Now, when we talk about chronic condition, we look at long-term effect of these problems, long-term issues that occur if you don't treat your diabetes. Diabetes can cause you to be blind. Okay, it can cause retinopathy in your eye. It can cause you to have, again, we talk about neuropathy already. It can mess up your kidney. Okay, it can cause you to have kidney failure, kidney disease. It can cause you to have other conditions like heart problems. So all those conditions can be caused by uncontrolled diabetes. So what I want you to do, if you're watching this video, one of the things you can do, if you know a family member or if you know that you have diabetes, is to make sure you take your medication. If you take your medication, you manage it, you go to those appointments, we'll make sure it stay under control, and we'll make sure you don't develop all those complications such as unhealed wounds. So that's another thing too. If you have a cut or you have a wound that does not heal, for diabetic, it's very hard. When you have wounds, it's very hard to get them, for them to heal. The seniors, you want to encourage them to always inspect their feet. This is extremely important. You want them to look at their feet, because usually people with diabetes, because of the neuropathy, sometimes they may step on a stone, for instance. I've seen it. A patient would come in and will look at the bottom of their foot. They've been complaining of pain in their foot. And when you look, there was a little stone that actually got in their foot because they don't feel it. So this is very important that they do frequent feet inspection. You want to make sure they check their feet. They dry it up when they after they take a shower. They keep it dry, keep it clean, because you don't want any infection there, because a lot of the time you would have that wound and you will not even feel it. Okay. And again, especially when we talk about seniors, those people are already at risk for poor healing because of other complications and all that. You're talking about a lot of comorbidities. So your goal is to help them so they can manage their diabetes. So they know they have it. They know they have to take their medication, the insulin or the pill, whatever they're taking, they need to take it. And they need to know this is important for you to take, because if you don't take it, it can cause you to have issue with your eye, with your kidney, with your heart. So we want you to take this medication, and it's extremely important for you to take it on a continuous basis. So anybody who is sitting here watching this video, I want you to continue to share our videos. As I usually say, we are here for the community. I want you guys to help me in this journey. I want you guys to help me, to encourage me to continue to bring more topics, to continue to bring more education for our community, mainly for our seniors, for family members of seniors, so they know how to take care of our seniors at home. Again, we are part of a home care company ourselves. We do private sitting and CNAs. So if you know anybody who is in need of a service, like who need a sitter, who needs somebody to come and help them with light housekeeping, who needs somebody to help them with meal preparation, getting out of the bed, or taking them to the doctor's appointments. So please let them know that they can call us 678-696-9905. And again, we do free evaluation. Free evaluation. We come in there, we help you. If you know anybody, you have a parent, you have a grandparent, we have a friend, or somebody you know who need some help, we are a licensed agency in Georgia, and we cover over 10 counties. We give great service, so we would please ask you guys to continue to share our message, continue to tell other people who may need our service, continue to tell them what we do. When you call us, it doesn't cost you anything except that you're helping somebody else. You're helping somebody else who maybe if you didn't call us, who would be falling and the next day. So what I want you to do is to call us. Let us come by to evaluate those people. We are professional. This is what we do for a living. Call us and let us know how we can help you. We'll be very happy to help you. So please continue to follow us. Continue to like our Facebook page. Continue to follow us on Twitter, on Instagram, we are also on YouTube. So please continue to follow our videos. Thank you for watching. If you have any question, please let us know. 678-696-9905. You can also visit our website at www.awchomecare. Again, we talk about diabetes, a very important topic. If you know anybody who's taking diabetic medication, please encourage them to continue to take their medication. Continue to help them, assist them. If they are not well educated about the subject, we'll be very happy to come by and talk to them and educate them. It doesn't cost them anything for us to do this. If you are part of any community center, any community area, any place there are seniors who need education, that's what we do. We go around, we provide free education for our seniors. We know that they need that. We know that this is the time for us to take the time to help them, to assist them, because they did that for us when we were younger. Thank you again. Thank you for watching my video. Continue to share it. We'll see you possibly tomorrow. If not, the day after tomorrow. As you guys know, I've been very active in providing a lot of education. I've been putting a lot of education. If you go on my AWC Home Care YouTube channel, you'll see tons of videos and tons of education that we've been having for our seniors, for our family members. So again, thank you for the support. I love you all. So take care, and you all have a nice evening. I'll see you tomorrow or the day after.